Hi, and welcome to Hub's Virtual Summit. In this session, I will be covering employee relations and U.S. labor and employment law. For those of you in Canada, welcome to our session, but I have good news for you. You get a break. The Canada session will be following mine. In the meantime, let's get started with some U.S.-based employment law considerations in the coronavirus working environment. Today, we're going to talk about employee relations, and we're going to talk about some measures and important steps that you can take to help mitigate the risk of having your workers come back to your workforce, or for those of you who have been able to continue your operations, continuing to operate your business in the coronavirus working environment. Who would have ever thought we would say that sentence? Okay, so there's a couple of things that I think we should talk about that are a bit hindsight retrospective. 9 weeks ago, when the coronavirus hit our work environment and our businesses and the United States, none of us could catch our breath. I know that I was on calls every day, 15 hours a day, back to back, talking to clients, helping them navigate and manage this incredible crisis in our country and in our work environments. So now it's time to take a breath and look back for a minute and talk about some of the things that we may need to do to button up decisions that we made 6, 8, 9 weeks ago. And one of those decisions and considerations is the Federal WARN Act. Now, the WARN Act is a very special law that applies to organizations that meet very specific criteria that you see here on this slide. Employers with 100 or more employees, not including part-time, or employers with 100 or more employees, including your part-timers, if in the aggregate, they average at least 4,000 hours a week in total. Part-timers also have a very special definition under the WARN Act as well, and that threshold is 20 hours. Why are we talking about WARN Act? Because WARN Act governs the things that employers must do with respect to notice in the event of a mass layoff, or in some cases furlough or organizational shutdown. And under the WARN Act, there is a 60-day advance notice that employers are required to give to their employees to give them a heads up that they'll be losing their jobs. And this law exists, or this notice exists, so that employees have an opportunity to financially and otherwise make plans, get health insurance coverage, get a new job, whatever it might be. But like I said before, things happened so fast 8, 9 weeks ago that none of us had a moment to breathe and think about things like the WARN Act. Well, the DOL was kind enough to release some FAQs on the WARN Act in particular. And they have shared with us some guidance for organizations that met those circumstances, that moved so fast that may have missed that opportunity or that obligation to get that notice out. And the DOL talks about circumstances that are unforeseen business circumstances. And if you fall into that legal technical category or exception under the WARN Act, then if you can get some notice out to your employees as soon as practicable, and you explain why you didn't provide that 60 days advance notice, then you might be okay. You've got to be able to document and prove up, if you will, why you weren't able to meet that 60 days. And of course, what we recommend is that you work with outside counsel. WARN Act is a very complex set of regulations and rules. It's very nuanced, it's very detailed, and we really suggest that if you think after my description, WARN Act may have applied to you and you might have missed that notice, that you reach out to your outside counsel and talk to them about what obligations you may have had and what you should do now. The good news, like I said, is that the DOL has contemplated that these things have happened and have provided some guidance for us. So let's get into your employees in the workplace. Essentially, guys, for those of you who have been on my programs before, some of this is familiar. The content may look familiar, but the information that I'm going to speak to has most definitely evolved and changed in many cases. So stay tuned. Don't give up on me. There's some new and updated stuff that I need to share with you now. Number one, threshold understanding that your employees are going to fall into likely one of these 4 categories. Everything from the far end of the left on the spectrum, which are your fearful employees, all the way to the right end of the spectrum, which are your highest risk diagnosed employees. And my question for you is, what is your plan? How are you going to manage and respond to each one of these categories of employees? For example, I get lots of questions about, can I require my employees to come to work even if they're afraid to come to work but have no underlying health conditions, have no one at home with underlying health conditions, and the only thing stopping them from coming to work is that they're afraid to come to work? How are you going to manage that worker? What is going to be your process? Will you have conversations? For example, the EEOC recommends that you get to the bottom of their fear, understand what's stopping them from coming in, and maybe by the time you're done with the discussion around what's holding them back, you may be able to remedy that or overcome that fear, and they'll come into work. High-risk employees. These are folks who have underlying medical conditions, are of a certain age 65 and above, or have family members at home that are high risk. I got a phone call last week from a client who has a workplace superintendent, project manager, whose wife is very, very pregnant, 8 months pregnant, in fact. And the doctor said, if you want to be in the room for delivery, you need to be home. And by the way, you can't go out and be exposed because you put your very pregnant wife at risk. And so the client called me and said, what do? We need this employee on site. How do we manage this? These are the circumstances that you'll have to contemplate as you build your workforce readiness, return to work programs, policies, and processes. What are you going to do for employees who are exposed, and likewise those who are diagnosed? Your response plan and your process is essential. Beth Anderson later is going to be speaking to organizational resiliency, pandemic planning, and your processes that you can build to be ready not only for now, but in the future. Okay, so why is all of this important? Putting aside the human element and the fact that we love and care for our employees, the OSHA General Duty Clause creates a formal federal regulatory obligation for employers to provide a safe working environment for their employees. In particular, the OSHA General Duty Clause is triggered when you have a workplace that may contain hazards that cause a threat to the employee's health or safety, causing serious harm or likely death. If that doesn't explain or describe the coronavirus, I'm not sure what does. And so from a federal standpoint, you have an absolute obligation to create that health and safety plan and that return to work program. So it's not just a good idea for your business, but federally speaking, it's absolutely required for you to do this. But the good news is Hub is here to help. So let's get into how you can manage the risk in the workplace. And I got some new updated information and some clarity that I want to provide on some of these measures. There are a number of things that you can do with respect to your employees in particular. Now, I want to make something very clear. What I'm talking about today is only one component of an entire comprehensive plan. Before I mentioned Beth Anderson, but I also want to reference Scott Fouts, who's coming up later today. Scott is going to talk more about your facilities and the workspace and the workplace. I'm speaking about your employees. Each one of the sessions today in our summit is designed to help you take all those puzzle pieces, put them all together, and create one comprehensive plan for your workplace and for your workforce. So what are you going to do with your people? You're going to take temperatures? You're going to ask symptom questions? Are you going to ask exposure questions? And oh my God, testing. The amount of questions and information around testing. It's on Facebook, it's on LinkedIn, it's in your email, it's in the news. Everyone's talking about testing, but there are very specific rules about what you can, and more importantly, cannot do in the employment context. And that's what I'm going to try to clarify and crystallize for you today. Okay, let's start with screening. I want to delineate between screening and testing. Screening are medical questions. Screening includes temperature taking. Screening is the conversation that you have with your employees about their conditions and their exposure. Testing is different. Testing is something we're going to talk about in a minute. So let's talk about screening. In the COVID-19 crisis, you can ask medical questions solely with respect to the coronavirus. You can't start asking employees if they have cancer, if they have a heart condition, how their rheumatoid arthritis is doing, or if they have rheumatoid arthritis. The questions that you are free to ask are designed to limit or eliminate community spread, eliminate that direct threat in the workplace of transmitting the coronavirus. The CDC has set forth very specific symptoms that you can ask about, and that's what you see on your screen here. And if you've been in the Coronavirus Resource Center or if you're on the Hub emails, then you've likely already received our screening template form that you can customize and use for your own organization. Now, before I mentioned testing, let's talk about that. The EEOC issued one and only one FAQ on testing. Way to be thorough. But that FAQ is chock full of important, heavy-hitting language. The FAQ that they issue is number A.6. And the FAQ specifically is around whether or not an employer may engage in testing. And the answer is specifically, and I'm going to quote because the language is so important here. An employer may administer a test, quote, to detect the presence of COVID-19 virus, end quote. And the reason that employers can administer these tests or have these tests performed is, quote, to determine if employees entering the workplace have COVID-19, end quote. COVID testing, employers may engage in COVID testing, quote, to determine if before they enter the workplace, they have the virus. So guys, the language is very specific, and the testing that you are free to do is diagnostic. The big question floating everywhere now is antibody testing, right? That's like the new Louis Vuitton or Vans or trend. Everyone's talking about antibody testing. 6 months ago, I was talking about new Louis. I was much happier to talk about new Louis, trust me. But today we're talking about antibody testing. Antibody testing is not allowed under this FAQ. Why? Because the presence or absence of antibodies in your system does not eliminate or limit community spread, does not go to the direct threat posed by the coronavirus in the workplace. If I'm fortunate enough to have the antibodies, I hopefully may have immunity to the coronavirus. Maybe not, we don't know yet. But none of that has to do with whether or not I'm a carrier of the virus today and whether or not I pose a direct threat to a coworker or someone else in the workplace. So I really wanted to emphasize that for you. There's a lot of confusion and a lot of questions, and I hope that explanation clears up some of the murkiness. A couple other points the EEOC made, also likewise very important. As you choose your vendors and you choose the tests that you're going to administer for diagnostic testing, the EEOC instructs that you must pay attention to the reliability and accuracy, paying attention to positive and false negatives, false positives and false negatives. How do you do that? Look at the tests that have been approved by the FDA. Look at the CDC guidance on the testing. Look to your government officials to identify the tests that would be appropriate for the workplace. And again, like I've emphasized, the EEOC also emphasizes that this should only be one component of a much larger infection control plan or risk management plan in your workplace. Now you've gathered all of this information, you've asked questions, you maybe did a pre-screening form, you might have tested your employees, and now you have all these records. You have more medical information about your employees than you probably ever wanted to have. What the heck are you gonna do with it? As a threshold matter, the information that you've gathered is generally controlled by the Americans with Disabilities Act. It is not HIPAA. HIPAA information comes from your health plan. But like HIPAA, the ADA has very, very high standards when it comes to confidentiality and privacy of that medical information. You've got to store it in a separate, secured, locked file. And the only people who may know identity and diagnosis are those who need to know. Need to know is super narrow, super high standard. For example, an employee charged with doing contact tracing to find all those exposed to someone diagnosed positive, they need to know the identity of the person, right? That only makes sense. But does the floor manager really need to know of his 300 employees which one tested positive? All the floor manager needs to know is that Bob or Sally Sue won't be into work. All the coworkers need to know, or anyone exposed to Bob or Sally Sue, all they need to know is that Bob or Sally Sue are not coming to work. Likewise, they need to know that they may have been exposed to somebody, not Bob or Sally Sue. The identity is not meaningful. What is meaningful is the exposure. So guys, we're talking about the what, not the who. Only very limited folks will know the who, but you've got to let people know the what. You've got to let people who have been exposed to Bob or Sally Sue, that they've been exposed to someone that tested positive with coronavirus. Now, what about employee exposure? Can you ask employees about who they've been around, who they've been exposed to? And the answer is yes, within the limits of the coronavirus, right? Again, we don't want to know about their general medical. We want to know, do they pose or could they pose a direct threat to the employees or others in the workplace? And it's within that framework that you can ask, have you been exposed to anyone waiting for test results? Have you been exposed to anyone with symptoms? Have you been exposed to anybody who's been tested positive or diagnosed? Why do I say anyone and not family? Because under the Genetic Information Non-Discrimination Act, you are prohibited from asking about family member medical conditions, but you can ask who they've been exposed to generally. And really, if you think about it, isn't that what you really want to know, right? What you want to know is the exposure. It doesn't matter who. It could be the neighbor, it could be the post person, or it could be mom. Who doesn't matter. The exposure is what matters. Okay, what can you share? I already got done telling you that only those who need to know may know the identity. So what are you going to say to Bob or Sally Sue if they test positive, and then what are you going to say to your workers? Well, it's absolutely necessary that if Bob or Sally Sue test positive, you sit down and have a conversation and ask them the last time they were in the workplace, who they came into close contact with. Close contact has a very specific meaning. Under the CDC, close contact means more than 10 minutes without any PPE within 6 feet. So if they've had close contact within 6 feet for 10 minutes or longer, no PPE, with Bob or Sally Sue, and Bob or Sally Sue test positive, then the person that meets that criteria must be informed of the exposure. And you're going to share with others that that exposure occurred. And by the way, when Scott Fouts talks to you, he will talk about customers and visitors. I am talking solely about employees here, but really, if you know of exposure, if you know of diagnosis, whether it's a third party or an employee, you have an obligation to share the information. Now Bob and Sally Sue are ready to come back to work. They've healed, they've recovered, they did great, and they're ready to come back to work. What do you do? Well, there are two different ways that you can determine when Bob and Sally Sue are ready to come back to work: test-based strategy and a non-test-based strategy. We recommend you offer both to your employees because in some communities, testing is just not that readily available. If you're going by the testing strategy, no fever without any fever-reducing medication, improvement in respiratory, 2 negative tests at least 24 hours apart. Non-test-based strategy, at least 3 days since recovery of the fever, no fever-reducing medication, and at least 7 days since the onset of the symptoms. If your employee that was diagnosed with the coronavirus meets one of these 2 strategies or criteria, then they can come back to work. Now, why are we talking about all of this? And this is really where I'm gonna start to wrap up the program, but it's a big wrap. Negligence. The tort litigation that has been filed to date and is positioned to be filed going forward is pretty significant and monumental, unprecedented, much like the coronavirus. So generally, employees are precluded from suing their employers for personal injury or negligence because if there's a personal injury in the workplace, it's usually covered by work comp. But unless there is a special circumstance associated with the employee's job that created a far greater risk of getting coronavirus in the workplace, you're not going to have work comp coverage for the transmission of coronavirus in the workplace. If you're in the hospitals, caring for coronavirus patients, police, fire, EMTs, that's very different coverage. Work comp is usually responding to those claims. But for an employee in a white collar environment, for example, coronavirus is a communicable condition that you could get in the grocery store just as easily as you could get at work. So you don't get that exclusive remedy for protection under work comp. And so employees are suing for personal injury or negligence. The argument is that the employer had an obligation to provide a safe working environment. They breached that duty, and the breach of the duty caused the damage or the harm. We've already seen these lawsuits in the cruise ship industry. There's been mass class actions by employees against cruise ships. And of course, you've heard about the meatpacking industry. What are the claims? The claims are that the employer did not do the things they were supposed to do to provide a safe working environment. In other words, following the guidance and the direction from the CDC and OSHA. Employee training, PPE where required or necessary, social distancing, cleaning, disinfecting, physical controls, employee screenings, on-site audits and inspections. Guys, if you follow the directions from CDC and from OSHA, you put yourselves in a very defendable position. The good news about personal injury or negligence litigation is that it stems from the employer's behavior, its acts or omissions in the workplace. So if you engage in proactive preventative measures that follow CDC and OSHA guidelines, you're in a defendable position. Keep in mind, you gotta have the records. Keep your documentation, keep the records of your efforts to provide that safe working environment for your employees. So where does that leave us? Some wrap up tips and summary for you. Develop the policies. If I didn't say this 15 times, I'm going to say it for the 16th time today. Your workplace response plan. Listen to Beth Anderson's section. Listen to Scott Fout's section. They're going to give you some really tangible, terrific suggestions and ideas for building out your workplace safety program. Take a look at the Hub ebook on getting back to business. We give you checklists, forms, and all kinds of tips to build out a comprehensive program. Consider your employee screening and your employee testing. One warning about testing that I want to share with you: we strongly recommend that you work with third parties and that you don't do the testing yourselves. Testing requires obtaining employee or human bodily fluids. That's controlled by the bloodborne pathogen standard. I don't know of anybody who wants to start sticking swabs all the way up people's noses. Please work with third parties unless you're prepared to comply with the OSHA bloodborne pathogen standards. Think about the documentation and the record keeping that you're going to have. And first and foremost, all of you on the phone today, be safe. Thanks so much for attending. I hope that today and this session in particular was helpful for you.